Hello, my name is Teryn Gianunzio. For this project, I chose to use fall prevention, a multidisciplinary approach. Falls, are they a problem? Falls, why do they happen? Well, on the patient's end, it could be a physiological change, a chronic health condition such as heart disease, dementia, and hypotension that may cause dizziness. Sometimes it may be vision and hearing impairments, muscle weakness, and illnesses that may affect balance. Medications, feelings of pride, and let's face it, sometimes patients have a lot of tubing. Could be oxygen tubing, IV tubing, catheter tubing, and they're a little difficult to maneuver. And sometimes it's just as simple as the patient being unfamiliar with the environment and just can't reach what they need. Also, falls happen on the healthcare team's end as well. Sometimes there are shortages in nursing and ancillary staff. Call lights or adaptive equipment are not within reach or not answered within ample amount of time. Non-implementation of toileting schedules. And sometimes it can be due to lack of bed and chair alarm usage. So the purpose of my capstone project was to develop a multidisciplinary approach to prevent falls. Fall prevention methods should be utilized by every discipline that encounters and interacts with the patient. Nurses, nurses' aides, physical therapists, occupational therapists, transport personnel, and even housekeeping staff should all take place in fall prevention methods. So for my project setting and the target audience is the med-surg unit that I work on. So I work on a medical surgical / telemetry unit in a local hospital that consists of 44 beds. The average age of the admitted patients between January 1st, 2019 and September 30th, 2019 was 68.2. So we do cater to a relatively older group of patients. The number of falls between January 1st, 2019 and September 30th, 2019 were 47. All 47 of those patients received a head CT. Average cost of a head CT in the United States is $3,275, which means just the head CTs for the falls on my unit have cost the hospital $153,925. So how will the project improve healthcare? Well, first and foremost, I'm hoping that it'll reduce the number of falls and improve safety to the patient. Also reduce the amount of injuries as a result of falls and reduce the cost to the hospital that falls cause. Holding more than just nurses accountable in fall prevention strategies, to me, I feel is a great deal as well. So what is the nurse's role in fall prevention? When a patient comes in, we complete the Johns Hopkins Fall Risk Assessment on admission for every patient. We determine if the patient would benefit from a bed alarm or chair alarm, determine the patient's baseline level of ambulation and use of assistive devices. Then we place assistive devices within the patient's reach. We orient the patient on the use of the call light for assistance, update the patient's whiteboard with appropriate information regarding the patient's needs. This way, if someone comes into the room that is not the nurse and they have not met that patient, they know how many people and what devices they need to safely ambulate that patient. And then, of course, reassess the patient's needs and update as needed, and of course, hourly rounding. So the CNAs also play such a vital role in our day-to-day care, but especially with fall prevention. So we need to, as nurses, communicate with our CNAs to ensure the plan developed is implemented. We need to make sure that the aides are using the patient's assistive devices when ambulating, turn the bed alarm on and off when returning the patient back to either, making sure a second person is there to help if the patient is deemed a two-person assist, hourly rounding, and placing the call light and needed items within the reach of the patient at all times. Physical and occupational therapy also play such a vital role in preventing falls. So they work with the patient to determine the patient's baseline level of mobility. They determine what assistive devices will be needed to safely ambulate that patient. They should be updating the patient's whiteboard under the mobility section and inform the nurse immediately of any changes that may have taken place. So the transport team are responsible for picking up patients and taking them for testing and bringing them back. And transport is such a vital role in the hospital setting. What I would like for transport, or what my idea for transport was, is to check with a nurse prior to attempting to ambulate the patient to determine the patient's baseline level of functioning. I'd like transport to ensure all assistive devices are being used, and then upon returning the patient, ensure that the bed or chair alarm is turned back on, and the nurse is directly notified that the patient is back in the bed. Housekeeping. So every room should be made up with a bed and chair alarm pad in place. There are times when we have less than 5 minutes notice that we have a patient coming up from the emergency room or the operating room. So we try to get the most important things in place. Sometimes these small details, such as a fall alarm or the pad that goes under the sheets, are overlooked. Once a patient is in bed, it may be difficult. The patient may be in pain, so it may be a little difficult to get that pad under there. I feel that if the pad is on the bed every time, then there shouldn't be an issue in using it. My theory is I would rather have it there and not need it than need it and not have it there. So the housekeeping staff on my unit has been really fantastic about making sure every time a bed is made that there is a pad under there, so all nursing staff needs to do is plug it in. So for project implementation, at first, implementing my ideas was definitely a challenge. I met with the managers for PT and OT, transport, and housekeepers. They all seemed open to my ideas, and they arranged for me to speak to the staff. Then I met with every unit's fall committee to discuss my ideas. They all seemed open with the ideas as well. It was a struggle in the beginning to get everyone to get on board. However, after frequent reminders, it seems to now be running somewhat smoothly. For staff feedback, initially I felt like I was being a thorn in everyone's side. When I would ask questions, I would get answers like, I don't have time to check, or people will always fall anyway. Over time, PT and OT, as well as transport and housekeeping, started holding up their end of the plan and things started to run smoothly. Last week, I sent out a survey to the staff on my unit, and the first question was, do you feel that having a multidisciplinary approach to a fall prevention is beneficial? Of the 37 nurses who completed the survey, all 37 of them answered yes to this particular question. So my findings, between January 1st, 2019 and September 17th, 2019, there were a total of 47 falls on the unit, totaling 1.27 falls per week. Between September 19th, 2019 and December 4th, 2019, there were a total of 10 falls on the unit, totaling 0.9 falls per week. Although it does not seem like a huge difference at this time, I feel that continuing with these implementations will have a great deal of impact in reducing falls on the unit going forward. Overall, I feel the project went well and is continuing to go well. Since we only had a short amount of time to come up with an idea, implement, discuss with management, and get everyone working together, It is impossible to know how much of an impact the project had. The fall committee on my unit has agreed to keep this new method in place, and we will reevaluate its effectiveness at our monthly meetings. Longer research will need to take place to really know the true potential this new model will have. But for me, on my unit, I will continue to implement and reevaluate and make changes because I feel like lowering the number of falls is vital, um, not only for patient safety, but also cost to the hospital as well. Absolutely. Falls resulting in injury are a very common patient safety problem. Elderly and weak patients with fall risk factors are not the only ones who are vulnerable to falling in the healthcare settings. Any patient of any age or physical ability will be at risk for a fall, either as a result of physiological changes due to a medical condition, medications, surgery, procedures, or diagnostic testing. These are some of the statistics about falls in the healthcare setting. Every year in the United States, hundreds of thousands of patients fall in hospitals, with 30 to 50% resulting in injury. Injured patients require an additional treatment and sometimes prolonged hospital stays. In one study, a fall with injury added 6.3 days to the average hospital stay. The average cost for a fall with injury is about $14,000.